All right, so here's kind of the first, I'll say the first lecture for the video. This is from class this week, on-campus class. And so what I try to do is get, in order to make sure I kind of tell each section the same things when I go and I assess assignments or projects. I try to make sure each section has the same material. Now, granted, I can't necessarily say the same things all the time. I'm going to try to get Zoom lectures or this type of setup in class, but we've been in a different class every week so far, and we've had cancellations, and so I haven't been able to test this out in class yet, so bear with me. But yeah, anyway. So for this lecture, we'll talk about, what is truth, what is science. COVID kind of brought a lot of this to societal importance, because they would say there's the term follow the science, and it's like, okay, there's several paths of science. Which path do I follow for the science? And initially there was no science to follow. So anyway, so we'll talk about science and truth, the scientific process, and then evidence-based practice. And I'll say this again in a little bit, but for the evidence-based practice, I put some links. So if you're pre-nursing, pre-pharmacy, pre-dietetics, pre-whatever your kind of future career in health is going to be as of now, and it could be, maybe there's a future health scientist from a research PhD perspective. That'd be awesome. You'd be a dinosaur if that's what you wanted to do. It's rare these days, and it's becoming rarer. But if you want to talk about getting a PhD and doing some of this science, please ask. I encourage it, and a lot of faculty, I think, don't like to talk about it much, but I think we need more good people in doing the research. So anyway, there's that. So I wanted to start out with some main points from some of the videos I showed. I'm going to talk about some of these in general because I'm not sure which videos you have or have not seen, but I posted one pertaining to the dietitians and aspartame, and how the Washington Post attacked them for what they said. And it's one of those things in that perspective, that issue of attacking health professionals because they may be paid by industry. So yeah, that may happen. Just like a physician may be paid by a pharmaceutical company, or they may even be paid by their own hospital or an insurance company to do X, Y, or Z. The key thing I'm going to need to ask you to do is, okay, make a note of that, and then fact check, get receipts of what they say, and is what they say supported by scientific evidence? And so we'll talk about and I think I posted in Module 2 some of the What the Health excerpts. I'll do a separate video for that, but this comes out, I think, it's more evident of these issues in some of those debates and some of those discussions. So anyway, so one issue is some things cannot be proven. And so you may hear something on social media, Thanksgiving, a holiday, you go back home to family, or family comes to you, or you're a caregiver and the clinician is saying this or that about the condition. Just there's always room to fact check. And so one of the things I'll get to here in a minute, and it's on the top of my mind right now, is, brushing teeth. Why do you brush your teeth? So part of it may be it makes your mouth feel and smell good. Okay, fine. From an oral health perspective, why do you brush your teeth? Because mom said so, or dad said so, or parent or guardian or whatever said so. And if you're a parent, you probably say that to your children, or friends if they come and spend the night over or whatever. And so have you seen the evidence on that? It's, going back, when I looking back and kind of preparing for this, I can't say that I could list a reference for that. I've seen some science on it, but I can't, say, well, there's a study done at this institution or dental program or dentist clinic, and these are the results. It was done this year. These are the authors. I don't think I could do that. So anyway, just an example. So some things can be proven. The issue is, are there data? And we'll when we talk about the videos, this is where people who are very successful have receipts, know what the receipts say, know what was purchased in the receipts. In other words, they know the studies, they know the data kind of fairly well, so they're well versed in that area of health or science. Some questions are untestable. So in one of the videos, it was, basically the presence, how did we come to be? Was it Big Bang Theory, or was it a divine intervention, the Adam and Eve Genesis type of model? And we can't prove that, as the scientist said. There's evidence for both versions of that, but at the end of the day, you have to, from my stance, I'm open to both options. I don't know for sure. I have thoughts. There's some interesting evidence of divine intervention. There's some interesting evidence for physical, biological creation. And there's limits to both of those in kind of getting back to following, one versus the other. The evidence doesn't sometimes make sense in one version or the other. So anyway, so some things are untestable. The question may pertain to historical events. That's one. So that's the kind of the religious versus Darwin kind of approach to things. We may not have the equipment or tools for accurate, valid assessments. So example, what do you need to determine whether someone has diabetes? One, what is diabetes? And so many years ago, hundreds of years ago, diabetes wasn't an issue. At least it may not have been called diabetes. But as technology has advanced, we've been able to get a better picture of that and be better able to test for it because of technology and things like that. And so there may be some things now that we have questions, how do you cure cancer? Well, right now or maybe a better one would be Parkinson's disease. Because for some cancers, you can cure it by removing the 100% of the tumor. Some tumors aren't fully removable, but some are. So anyway, but Parkinson's disease right now, there's no known cure. And so we're close. And so much like this, diabetes was once, how do you cure that or how do you treat that? We're now in a similar situation with Parkinson's disease and things like that, but we need accurate and valid assessments. Some statements misrepresentations of data. Could be by accident or a misunderstanding. Could be with intent and unethical. And we'll talk about Dr. Brian Wansink is a classic case in at least the nutrition realm. If you recall, he's the I'll say unethical scientist, I guess, who kind of gave us the notion of if you sit further away from the buffet table, you'll eat less, you'll make fewer trips to the buffet. Those who sit closer to the buffet tend to be more likely to have a higher BMI, make more trips to the buffet, those sorts of scenarios. He also, I'm trying to think of, some of the sensory stuff. He was from Cornell, as a food science lab, so anyway, but he was shown that he kind of made up some data for a lot of that stuff, and so he's took a big hit, and no longer. It's one of those things excommunicated from the science community. So in essence, as a scientist, all we have is our integrity, and so the minute we lose that, the minute we do something unethical, especially with intent, it becomes problematic. Accidents happen, it's one of those things where I'm trying to think. I think I had a study in which it was published, and I think there was something with one of the data points. It was either we put the decimal point in the wrong spot, or we switched the standard deviation for one variable with another. I can't remember which of those happened, but we just had to make a correction. We caught it later. It really didn't affect the outcome. It's just one of those things where it's like, it doesn't, given the means and other things, it looked odd, and we didn't catch it before we sent it. This may have been before some nice software packages that can make data tables and things like that. So we had to do all the data tables by hand in a Word document, which is not a fun way to go. But anyway, that's neither here nor there. That's historical. So anyway, so those are some of the things to kind of watch out for from some of those videos. And like I said, for What the Health, we'll go more into that here next week. So how do you know what you know about health? Who or what was most influential on that knowledge? Parents, teachers, physicians, healthcare providers, social media, Dr. Oz, or I'm trying to think of some of the others. The Doctor's TV show, Dr. Phil, Oprah. Oprah and Dr. Oz kind of go together. She kind of introduced him to mainstream society. How has your knowledge changed over time? Do you have different views about cupping, for example, in sports medicine, or flossing, or other aspects of health in which you used to believe one thing and now you believe something else? That adaptability, that change, is something you need to hold on to, because when people say, this happens a lot in diet and nutrition, so that's why I kind of focus on that. I guess you could say the same thing for some aspects of fitness, but this is better than that. Eat this, not that. Lift this way, not that way. Endurance training is better than resistance training. Those types of issues, they're contextual in my professional opinion. It depends on the person, other aspects, their age, where they live potentially, what resources they have readily available, all those kind of contextual things, the social determinants of health, if you will, can affect that. And so having an ability to be flexible with how you understand things will serve you well in the future. And so the ways we tend to learn: personal experience, parents or our culture, media, the social network, formal education. My perspective is each of these, one of these is not necessarily better than another. Each of these, so I make fun of TikTok a lot just because I know there's a bunch of misinformation, bad information that's put out on TikTok. But there's also TikTok can be used to be informative. The issue is how the algorithm works and where that information can and cannot get to based upon the algorithms. And so sometimes the intended audience may not be able to get to that intended audience because their algorithm is geared more towards this other type of information. So you may not be able to reach everybody. But so there's good and bad for all these traditions, cultures, health PE classes, etc. Some of them may be more aligned to be more trustworthy than others, but I don't think there's anyone that's error-free, and I don't think that anyone that's error-full, if that's a word. So kind of an example of this, a friend tells you, I took tart cherry juice and went right to sleep. So therefore, tart cherry juice works. Does tart cherry juice help with quality and or quantity of sleep based upon that statement? I don't know is kind of the best answer. I need more information. So it could be they had a really hard day at work, they exercised at a high intensity, they kind of just maybe overstressed themselves and were tired anyway. And so the tart cherry, I need to pick a different option. The tart cherry juice was just something that was insignificant, but due to the timing of it, taking it right before bed, it seemed like it worked. So there could be a placebo effect. That's the other thing. A placebo effect could work. I heard this is supposed to help. I took it, and it seemed to help. Therefore, it helps. And from a sports nutrition perspective, the placebo effect I think is pretty strong, and I tend to align with human performance. That hey, if you think it works, I wouldn't not take it. It may not, as long as it's not doing harm. You may not be doing anything, but you may think it is. So therefore, it may be. Or if you don't take it, you may think I'm going to perform worse because I didn't take it. So anyway, there's the mind is a tricky beast to try to work around or work with. So obviously, one of the assignments, the first assignment is headline and study. So a headline was diet containing specific amino acids can improve metabolic health. And here's the actual article, so you can go there if you want. The press release, forget calorie counting, diet low in specific amino acids may be the key to weight loss. And so here's the actual study title. Press release or headline, forget calorie counting, diet low in specific amino acids may be the key to weight loss. The issue is, I can't cover this part up. I was going to cover it up with my hand, but that doesn't help you. If you just look at this, it's like, oh, it looks like it's in humans, right? Well, no. The study was actually done in mice. What do mice eat? Is their food different than what you eat? It's, in general, it's a lot like what we feed our pets. It might be considered chow or pellets. They eat the same thing every day. And the diets were configured in such a way that it was all processed, ultra processed, so that it was 100% ultra processed. And some of them still lost weight. It's interesting. We're talking about food processing. Some of the food processing was more healthful from a body composition perspective than others. More on that later, and we can talk about that offline separately too. That's soapbox I have a hard time getting off of. And so anyway, so the press release, the headline tends to lead one to think that this can help a human, and the study supports losing weight or weight loss in humans, but you can't do that with an animal study. Animal studies are actually one of the least reliable and applicable to human health. What they are good for, so I don't want you to think that animal studies are terrible. I'm not going to listen to an animal study. What they are good for is figuring out how might this affect a human. Here's some interesting biochemical pathways that seem to be evident for this. Can we set up a human trial to see if we can get the same outcome? And that's one of my goals is for scientists to, especially nutrition or health scientists, to do two studies in parallel, to do a human trial and an animal trial, because in an animal trial we can get mechanisms. And so if we can get the human trial and the animal trial to have similar outcomes with whatever the intervention is, maybe the animal data will help us better understand some of the physiology that's going on, the biochemistry that's going on, or maybe psychology that's going on to elicit that change. So animal studies are valuable. I don't want you to take it away that, oh, Dr. Hobbs is bashing animal studies. Not at all. They're the best means of getting mechanistic data for health outcomes. So, how do we learn the truth? We need to read, investigate, and most importantly, ask what if, what about types of questions. Why? Turn into a kindergartner or a preschooler and just say, why? Why is that happening? What's going on that leads to this change? And or if we can kind of see, how can we change that? How can we reduce the incidence of heart disease? How can we reduce the incidence of Tommy John surgeries, or increase the rate, the return to play, decrease the time to return to play in people that have stress fractures or other type of orthopedic impairments? And so that, from a sports perspective, a lot of people, so not sure, hopefully you're all Chiefs fans. May not be, hopefully not Baltimore Ravens fans. Anyway, but there's a lot of money. So if somebody gets injured, like if somebody got injured, I can't remember, there was a Chiefs player that got injured, Edwards, I think. Anyway, I'm not sure what his issue was, but if he can get back on the field, the Chiefs likely have a better chance of winning than if he's not able to return to play until 8 days from injury. So if they can make it 5 days, get him on the field so that he doesn't get re-injured, then so that return to play is huge for especially professional athletes or athletes who their livelihood is dependent upon their participation in that sport. So one of the things that happens is as we learn things, as we get closer to understanding the truth, we can never understand it fully. In one of the videos, the scientist talked about this is the best knowledge we have on this. So it's not we know everything, because we don't. But you have a situation here early on, so this is time, and this is the amount that we know something. We think we know a lot early on. It's like, wow, this is interesting. You just learn about something, and you think, wow, this is really cool. And then the more you start to dig in, it's like, oh, wow, I really don't know what I thought I knew. And then over time, you get to know a little bit more and understand the complexities of things. And then once you spend a lot of time in that field, you get to be considered an expert. And so COVID came around, as you all know. I stayed out of it. I'm a scientist. I could have made some comments about this or that, but you know what? That's not my field. I'm not a virologist. I'm not an epidemiologist. I'm not a public health expert in that. So I just kind of let the people who that's their area of expertise make the comments. Just because I didn't want to mislead somebody, I didn't want to make a statement that I wasn't confident was close to accurate. And typically how I phrase things is, this is how I understand it to be versus this is how it is. Because my understanding, your understanding about something may be a little bit different based upon our experiences. And I'm not saying one or another is right. You're right or I'm right. We could both be right and have a little bit different view of things. It's like the cartoon or caricature. You have several scientists looking at and describing parts of an elephant. You know, and one person that's around the feed is saying, "Wow, elephants they're like big and round like a tree," and somebody says, "No, it's like a big leaf," and they're looking at the ear, and so it depends on the perspective. So both of those are correct. It's just one is looking at the leg, and the other is looking at the ear and describing the ear and describing the leg, all from an elephant, and so. That's kind of how we view health sometimes, is viewing diabetes from a liver versus diabetes from an adipocyte or a muscle cell or retina. And so you can have different effects on different organs, even for the same condition. So anyway, just wanted to mention that. And it's so as you start out in things, I just encourage you to be cautious. I encourage you to participate in discussions because that's how we learn, but also be forgiving and don't paint yourself into a corner and talk from this or that is right. 100%. No. It seems to be, I've seen data that show this. I haven't seen all the data, but I know some data look like this. So allow yourself some flexibility. If you can contribute to the discussion by adding those data points or those bits of information that you're comfortable with, by all means do so. But I would encourage refraining from being, this is the way it is. It's always this way. You know, it's the whole, I think probably most of you have learned that if a true-false question contains all or never, it's probably false. And that's why. This is exactly why. Because there's always exceptions. Oh, look what I did. I just said always. But anyway. So just kind of bear that in mind and try to be aware of kind of where you are on the scale. And this is relative to different topics. And so I tend to be out, I would say I'm out here sort of for diabetes, obesity, weight loss, macronutrient, carbohydrate metabolism types of things. I think I'm about here in some of the cancer-related things and related to influenzas. I'm probably somewhere here, maybe. I mean, maybe I'm in the valley of despair. I don't know, but I don't really have a desire to get out of that valley for that, at least not at the moment. I'll let other people do that work. So the scientific process, there's a problem or a question, and part of this class you will come up with some questions. You do observation, you research it, formulate hypotheses based upon those observations that you've seen or the research that you've gathered to date, formulate a hypothesis, experiment to test the hypothesis, collect data, analyze the results for differences or change, and then make conclusions and then disseminate. And that's kind of the scientific process. And so for the problem or question, is it testable? We talked about that. The other aspect is it meaningful? You know, I mean, I think the example I used in class was what color are bricks? You know, from a health perspective, I don't know that that's important. That's not, I mean, it's a testable question, but how meaningful is it to a diabetes patient? I don't know. No, I don't know that it is. There may be a link, but I'm not sure. What equipment or surveys are needed to do the work? For example, if you're wanting to assess weight change or body composition, there you have a DEXA and you have skin fold calipers. You're going to get different results from each of those, or you may even have just BMI to use. So just kind of bear in mind that the equipment and surveys that are used will need to be taken into context. What will the impact be for the field? So the COVID work was very impactful from 2019-ish, end of 2019 to 2022. I mean, that's where all, I shouldn't say all, that's where a lot of the research was being done. One is because other research was kind of shut down, and two, that's where the funds were. I was fortunate to be able to work at the state research lab in Kansas, which is in Topeka, and I helped the state with COVID testing. I didn't do much, but I was able to volunteer my time to help the state go through. So for those of you that may have been doing COVID testing and you had to wait, especially early on, I think I worked in the lab from about March through May while they were developing technologies to make it faster. But initially, it might take a week to get a COVID test. And so that work was really helpful. So the work that they did to even get to having a home test was fantastic. And then how's it funded? So food, especially food and health, nutrition, tends to be complicated by industry. And so What the Health kind of gets into that a little bit. So and as well as the Washington Post article about the dietitians. So if a study is funded by industry, some people just discredit it right away. A problem with that is if you did that with all the nutrition studies, we wouldn't have very many nutrition studies, because most I'd say 60 to 70% of nutrition studies have some sort of industry funding. It may not be everything. So for example, some of the work that I've done, I've gotten product from the company that makes it. They don't necessarily pay for the study, but they give product to test it, and we use other funding from government sources or university sources or awards, etc., to pay the rest. But they provide the product. And so if a dietary fiber company has paid for some dietary fiber and the placebo or control, it's supported by industry. It may not be fully funded by industry. And so therefore should you trust it? And this is where it goes to, well, look at the science. Did they use appropriate equipment? Did they use appropriate statistics? Was everything, so going through these questions, what are they appropriate? So the other issue for observations and research, what are the gaps in science? So maybe there's a lot of data on postmenopausal women and osteoporosis. What are the risks of osteoporosis in eating disorders or kids? What has been studied to date? And so the other thing you don't want to do is to do a study that's already been done. I know it's called research. I do mental gymnastics every time I kind of cover this, because it's like, well, why do they call it research if you're not supposed to redo it? But it's not that you're not supposed to redo it. Some replication is warranted in some cases, especially if the initial study was underpowered. We can get to that later. But what may happen is you're looking at it from a different perspective. You're using different equipment. So one study, maybe you may do the same type of study, but one You may, you know what, I'm going to use DEXA to see if we get the same result as we got with skin folds. And so you may be comparing methodologies to see if you get similar outcomes. And so the issue is replicating it exactly is kind of frowned upon sometimes, but sometimes it is warranted. So, hypothesis needs to be definitive. What do you expect to happen? And why do you expect that outcome? And so the example here is brushing teeth. What do you expect to happen? That brushing teeth will reduce dental caries. Where do you get the basis for this response? That was the question I asked earlier. And so for hypotheses, it needs to be testable and it needs to be definitive. And so usually there's some sort of directionality in a hypothesis. And so reduce, increase, decrease, those types of kind of words versus change. It's kind of vague. Do you expect it to go up or down, and why? If you have data from other studies to guide your direction or your expectation, it should guide you to a decision to say it will reduce or increase whatever the outcome is. In this case, dental caries or cavities. Hopefully that will make sense. We'll talk more about these issues. If data are not published or you're having difficulty finding it, maybe data science needs to test the theory or the concept. So search for evidence using PICO, and we'll cover that next week. And using PubMed, if none, conduct a scientific investigation or find somebody that's doing that work and maybe help them experiment with it. This is where, if there isn't any data, this is when we get to evidence-based practice. As a clinician, as a healthcare provider, sometimes you got to make a guess, an educated guess. You may have somebody's life in your hands, and literally, and you have to make a decision. And once you make that decision, you have to use the best evidence that you can to make that, to guide your decision. And you can't look back. That's the downside of healthcare sometimes is you may lose some people. That means they may die under your care. That's tough. But we need people, educated, good people to do that. The goal is that happens in extreme cases in which there's limited data. It's a rare case, and at the end of the day, your heart and mind were in the right place. You're doing what's best for that patient, that family, that caregiver, whatever the case may be. And so you either think about it as, what would I want people to do for me if I was the patient, or what would I want somebody to do for my family member? Just basically have a good connection between your mind and your experience and your heart when those cases get really challenging. So the types of scientific evidence, we'll get more specifically into this, but it goes from anecdotal expert opinions up here, and as we move down the list, the strength of the evidence increases. And so animal studies are good. Case reports, so this is where you have an individual case, a person, a patient, and you're describing what's presented. You may not have it, maybe a rare case like the condition that Celine Dion, the singer from Canada, kind of has. She has a rare condition. Then there's case control studies, cohort studies. We'll get into those. So it's looking at basically risk. What's the risk of certain exposures of smoking, of vaping, of saturated fat intake, of wearing a knee brace versus not wearing a knee brace, or the type of knee brace, those types of things. And then randomized controlled trials in which you control a situation. So you control dose of something, whether it's pharmaceutical, whether it's exposure to the sun for see how much sun's needed for vitamin D in athletes or older adults. And so you're controlling for those things, and there's problems with that, but there's also benefits. And then systematic reviews is when you take several studies about the same topic, about the same type of question in the same population, and then you analyze those studies that have been done to see what's similar. or a meta-analysis is what's next. If you have data that you can compare, you would do a meta-analysis of all those studies to get an overall kind of assessment of the condition from all those clinical trials that have, or the case control or cohort studies where there are data. Run your statistics. So I talk about a priori. So the key issue here is you make these decisions just like for the methods and everything else. You do this beforehand. So, for example, you write a grant. If the grant gets funded, you have to follow the steps that you laid out to the granting agency. There may need to be a change. So maybe new technology comes along and you have access to it. You can say, hey, we're going to use this, or request to be able to use this new technology. Haven't done the study yet. So before we do the study, we want to get your approval to be able to use this new technology for this method. It'll enhance the quality of the research, something like that. But you have to do it before. You can't change in the middle, and you can't go back and say, oh, we should have used these stats. Well, you didn't say you were going to, so don't. You can do a post hoc test, but you can't base that post hoc test will not address your hypothesis because it was post hoc. And so it can be an observation, exploration for further studies, but you can't put your nail your hat on it or use it to hang your hat on. Not a strong enough nail. Look for statistical differences. Then you decide which hypothesis or hypotheses were supported by data. Use prior studies to explain results. So that's part of the conclusion. To see, hey, we're either finding things that everybody else did, or our data match this group, the outcome of this group, but doesn't match the outcome of this other group. Typically, you present the results at a conference, so you disseminate it that way. You publish it, and maybe if you're lucky, you end up on a podcast with somebody like Joe Rogan, if it's something of interest. So in summary, the questions to ask, what is the difference between the study design on applicability? How does research funding affect a study? How do you use a study with different population than your patient? So that, for example, what that might mean is there's a study that looks at the condition you're interested in, but it's in adolescents, and your patient is 35 years old. How much do you trust the translation of that data from adolescence to your data of a 35-year-old human? And maybe even if they're different genders or different sexes. What do you do if authors overstate the outcome? And we'll talk about, I have a study that goes over this latter part, because it may not, because there's a tendency for authors and scientists to really like the work that they do. I'm proud of the work that we did. And so you may overstate the outcome sometimes. It's human nature to kind of say, this is very important. And it's like, okay, yeah, I don't disagree with the importance, but your data don't really support the strength of that statement you just made. It kind of helps. It may not be as grand as what you're trying to get. So this often comes up, is kind of discussed in the review process from reviewers and editors of the journals that publish the work. So that gets us, so that's the science that goes into the practice. So when you're a clinician and you look for evidence in science, so I posted in the announcement a short little video clip of Dr. Jordan Peterson, and he was interviewing a physician. I don't remember the physician's name off the top of my head, but they were talking about clinicians, in this case physicians, and the lack of skill most healthcare providers have in understanding evidence. Because they're too busy. I mean, if you're seeing 20 patients a day, you don't have much time, and then you have a family at home, you don't have much time to read literature. That's where, excuse me, I wish there was a better bridge between scientists and clinicians to kind of help with that. But anyway, the goal of evidence-based practice to incorporate the best available research along with clinical experience and patient preference. Key here is also including the patient preference into clinical practice to make informed patient care decisions. So for example, a cancer patient, you know what? They may want everything except chemotherapy. They just don't want to go through that, you know? And it could be their right to refuse. It's their body, so if they don't want to expose themselves to chemotherapy, should they be forced to? So that's kind of one thing to consider as well. So evidence-based practice ultimately is the cornerstone of clinical practice. So again, I put in Canvas some links to the evidence-based practice rules for several professions: dentistry, optometry, physicians, or family practice. I think I didn't get in, and maybe sports medicine from an orthopedic perspective. So check that out, and relative to yours. If I don't have your profession, I'm happy to add it, but just to kind of give you an idea. So athletic training has kind of theirs, healthcare competency, health profession education, healthcare economics, so just understanding various aspects of practice. Dietetics, this is a little bit older, but kind of gives you policy, education, practice. All those things feed into the professional aspects of research and treating patients. You know, and for this, you know, it includes food science, behavioral sciences, basic sciences, management, so food service management or managing others in the healthcare team, medicine and nursing. Utilize the best external evidence, draw on individual clinical expertise, and consider patient values and expectations. Boom. I mean, if you want to nail it down to the three basic tenets, that's a pretty good way to do it, in my opinion. So, summary of today's lecture: what do we really know? And typically it's not a lot. We tend to know a little bit, drips at a time. What's the scientific process? And then what is evidence-based practice? I hope you can go through and answer each of those. So until next week, I'll end here and wish you all a great weekend. And thanks again, and see you soon.